Hey, Nurse Awesome. So, a lot of you have already taken your first test and done awesome. Some of you have not quite met your expectations. So, you're asking me lots of questions about how on earth to work these questions better. So, I can understand this completely. My very first test, I studied probably 50 plus hours for, and I really felt prepared. I did okay on the test, I didn't do bad, but I certainly didn't have the grade that I felt like I should given the amount that I studied. So while I knew the information, what I could not do was figure out what the heck the question was asking me. I didn't know how to break apart the question and find the stem or what it is that it's really asking. I didn't know how to throw out the distractors. I didn't know how to look for keywords. And I certainly didn't really understand what it was that NCLEX was asking from me. So I want to make a few videos about this. The very first one, we're going to talk about the actual questions themselves, how to look at them. Then we'll talk a little bit about some strategies you can use when things get really tough and you're stumped. And then we'll actually work some questions in the last video, okay? First things first, what exactly do they want? Well, it doesn't really matter what your patient's condition is, whether they're an OBGYN patient, an 80-year-old man, someone with CHF, or somebody that just had basic surgery. NCLEX wants to know that you can keep your patients safe. And your instructors want to know that you can keep your patients safe before they turn you out into the real world to take care of patients on your own. This is a really basic tenet of nursing, same thing with medicine. First, do no harm. Do not leave your patient worse than they were before you got there. So that's what your questions are really asking you. They're going to disguise themselves in lots of different ways, right? But the bottom line is they want you to step through the process of caring for a patient, figuring out what's going on with them at that moment and what you can do about it as the nurse. They want you to use your judgment and figure out when you need to call the doctor, when you need to intervene, how you need to intervene, to the extent you need to intervene. Do you need to do something drastic, or can you do something simple and small that will keep them safe? Those are all components that go into working these NCLEX questions, right? So just if you can do nothing but remember the nursing process when you actually go in to take your test and practice using the nursing process when you're doing clinicals, when you're studying, it will help you a lot. So when you look at the question, think to yourself, where am I at in the nursing process? You've learned about this, right? Assess, diagnose, plan, implement, evaluate. This is something you're going to be doing as a nurse from here forward. And it doesn't matter whether or not you're taking a test in theory class, you're in the skills lab, or you're standing in front of an actual patient. I work in ICU now, and I use the nursing process all day, every day, from the moment that I clock in to the moment that I leave. So you guys start to just embrace this, and it will become second nature to figure out in the question what they're asking. So that's half the battle, right? If you know exactly what it is they want from you, then you have a much better chance of picking the correct answer, especially when you get down to where there's two answers that seem like they're right. One thing that will help you a lot is if you can get in the habit of working NCLEX questions every single day and asking yourself as you're working the question, what exactly is this question asking me? Where are the keywords? Where is this at in the nursing process? Does the question contain assessment data? Because if it does, then my answer doesn't need to contain assessment data. My answer needs to go to the next step of the process, which may be diagnosing or planning. If my question already gives me all that information, then maybe it's time for me to implement something. You would never walk into a patient's room and do something before you assess them, right? Right. You're not going to walk in and see somebody having a hard time breathing and just immediately go and throw some O2 on them, or walk in and have somebody say they're in tons of pain and immediately run out and get them some pain medication. You're going to assess what's going on before you ever implement anything. That's always what you're going to do as a nurse. So that's always what you'll do in the nursing questions that they're going to ask you on your exams. So getting in the habit of working NCLEX questions will help you a lot. I did at least 25 questions every single day. And I made them about, whatever it was I was studying. I had several books. Saunders makes a really good one. Hurst Review is a good thing to have. Most of the textbooks will have some questions to work. Do those, this will be a huge benefit to you. But don't do them and kind of not pay attention to them. I would spend like an hour of time every day working those questions. And while that seems like probably a lot for just 20, 25 questions, I stepped through that process in my head. What's the question asking me? What are the keywords? Where am I at in the nursing process? Where am I at in Maslow's hierarchy of needs? What should I do to keep my patients safe? I would answer the question, and then I would look at the rationale to the question, even if I got it right, because I wanted to make sure that my thinking was accurate. So you guys ask yourself that when you're studying. Where am I at in the nursing process? How can I use the nursing process to keep my patients safe? If you're not working NCLEX questions, you should be. It will help you immensely. Practice really does make perfect. The other thing that I can offer you immediately that will help, two things. Leave your eraser at home. Do not use your eraser, because second guessing yourself is when you're going to get a lot of questions wrong. If you don't have a really good feeling about the question before you answer it, don't answer it. Just move on and come back to it later, okay? Just don't use your eraser. The second thing is, don't read into the question. If you start asking yourself what if scenarios, you're reading into the question. You need to stop and regroup and look at the question. Only the question. What is the question asking you? All right. So practice with that a little bit. Use the nursing process as you're working your NCLEX questions. And then the next video we have, we'll talk a little bit more in depth about that. Okay. So hopefully help you have a better plan of attack when you go to take your next test. Until then, you guys study hard. You will be awesome nurses. I have no doubt. Peace.